Preceding the Commissioners' Workshop meeting, we do have a public hearing today. Today is August 18th, 2022, appointed hour at 9 a.m. We've arrived at that time, so we'll begin with our public hearing. This is in regards to the Human Services Block Grant, such an instrumental part of our human services funding structure. And we've got a lot of folks here who've done a lot of heavy lifting over the past couple of weeks and months on this. And as is required, we're going to present it to the public here and allow for questions and such. And we're fortunate to have all of our human services superstars here and Jack too. No, you know we love you. So anyhow, we're grateful to have such fantastic people here, and they're going to be presenting to us. I have no idea what order we want to start in, so Robin's going to begin. So.
Okay. Good morning, everyone. Good morning, commissioners. I'm Robin Tolan from the Cumberland and Perry County's Mental Health Office, and I have the charge to pull together the Human Service Block Grant Plan for our county. The Human Service Block Grant Plan contains 5 different categoricals: mental health, intellectual and developmental disabilities, substance use disorders through the Drug and Alcohol Commission, Homeless Assistance Program, and Human Service Development Fund. Those are both through the Office of Aging. So for the first 3, mental health, IDD, and drug and alcohol, we are a jointer with Perry County. We held a similar hearing on Monday evening in Perry County for those services, and we'll present similar information here. We do have a number of folks here willing and wanting to give testimony regarding the plan as well that can occur afterwards during your public comment section. I work in the mental health office, so the primary part that I'm going to talk about is that section. We also are probably the largest part of the block grant in terms of the funding and get the majority of our funding through the block grant for mental health services. The plan is set up in a structured way from the state, and there's a template that we have to fill out and to talk about our highlights, our achievements, our strengths, and our needs, as well as different populations within the community. There's a lot of information in the plan. The plan itself is about 85 pages, so if you need some bedtime reading, feel free. But there's a lot of good information in there as well. So to start with mental health, some of the program highlights for us. The main one would have to be the strength and perseverance of our providers. COVID did us no favors. Obviously, the pandemic really interfered with a lot of service provision and a lot of our abilities to support individuals. And we had to really change how we were doing things for quite a while. We are now getting back into being able to do more face-to-face. Telehealth is available more so than it had been previously. So that has been helpful, especially in areas that folks were not able to get to services. And that looks like that will continue as well. We've also been able to offer CIT training, crisis intervention training. That's a training that works with local law enforcement and our crisis intervention staff and our mental health staff. We have an individual here, Brian, who has been trained in that and is part of the local law enforcement here. We've had 2 trainings so far with that in Cumberland County, and that has been very effective at improving relationships within the law enforcement community and the mental health community, and supporting individuals with mental illness and how those folks, how interactions occur with those folks. The other exciting thing was, as of yesterday, Penn State Health Holy Spirit became live in the National Suicide Prevention Lifeline. So that was pretty exciting. That is you may have heard of 988. That's the new number that folks anywhere can call. And previously, calls for our area went to Butler County. As of yesterday, now they're going to Cumberland County. So those calls will be hopefully better managed with local folks and local resources. So that's a really exciting thing. We've been actually working on that for about 9 or 10 years. So it finally happened. So that's been a really good thing. We've also been able to receive some grants from various other entities because of funding issues. We did get a grant from the Pennsylvania Commission on Crime and Delinquency for covering overtime expenses for 911 and other staff to be able to attend the CIT training. So that was really beneficial. We've also gotten grants from the Community Mental Health Services Block Grant and the Garrett Lee Smith Foundation to support our student assistance program and in our elementary student assistance program, and utilizing the behavioral health works platform and tracking data and looking hopefully to then be able to see better outcomes or be able to show better outcomes. The outcomes have been there, we just haven't been able to have a way to show those. There's been a lot of other good things that have happened. We've also been able to open, just as of last week, our Perry County social rehab site in Newport. And that was a really exciting process as well. And we're pleased during the pandemic that service had to be scaled back and we weren't able to see people in person. So now we have a nice brand new facility that is going to be able to support that. And then as soon as we have the site rehab information and approvals from the state, which they've been working on since May, unfortunately, then we'll be able to open the psychiatric rehabilitation as well. Another really great initiative has been the community mental health workers. That has been funded by our managed care office and our managed care entity, and have been through Sadler in Cumberland County and through Hamilton Health in Perry County. And that has enabled folks to really focus on the social determinants of health and improving connections to needed services. On the needs side, however, there's been continuing to be system-wide need for staffing. Like I said, the pandemic didn't do us any favors, and we lost a lot of staff who either weren't interested in continuing to do the direct care human service function, or because of the pay, which leads into the other issue, which is the funding. For the, I think, 11th year in a row, we are flat funded for mental health, and that is not taking into consideration all of the expenses that have increased with regard to providing services in our counties. So really, if you look at that, we probably lost funding because needs for gas and food and for residential programming and for just staffing needs like insurance and things like that have gone up during that time. And that funding continues to be an issue for us. We continue to look at other options, other things that we can do, ways we can access. The problem with some of those other funding initiatives are they're very short term. They're 1 year, 2 year grants. How do you sustain that if your overall funding isn't improving? So those are some overall issues. Like I said, there is a lot of information in the plan about specific age population issues, specific other demographics as well. I will also speak about our priorities. We have 5 priorities that we've identified. And they remain similar. I'm just looking here to last year's priorities. The first and major priority is to maintain our current service delivery. That has been something that has been a priority for our organization for a number of years, given the budget crisis and the funding issues that we have there. The services that we provide, our constituents tell us that are extremely beneficial, and you'll probably hear from some of those in a minute, that those services have been very life-saving for them. And I think that that is the key point. We need to make sure that folks that are in the community that are being served and are being able to maintain their quality of life in the community with the services that they have. That is a major key issue there. So we will continue to have that as a focus, being able to maintain those services and be looking at what we can do within our budget. We are facing another budget deficit for this year just because of those rising costs. And so that is something that we will be monitoring throughout the year to determine if there are things that we need to adjust in some way. Unfortunately, I don't want to say that we would have to close programs, but that may in the end be something that we might have to look at if we're not getting the utilization or we're not having the funding to continue to support the wide range of services we've always supported. Further back in the plan, there are a list of all of the services we provide, who funds those. You'll see that there are a lot of services that are funded by our county-based dollars. A part of that is because our area has a lower percentage. We have about I think it was 35% of our folks are not Medicaid eligible. A lot of services are paid for by medical assistance, but about 35% of the folks in Cumberland and Perry counties are not Medicaid eligible because they either have a higher income, they're funded under private insurances because they worked for many years. Those are the types of things we're facing. So when someone is not Medicaid eligible, they have the access to those services through county-based funds. And that is some of the issue that we're facing at this time. The second priority is our alignment with the SAMHSA Substance Abuse Mental Health Services Administration, our best practice guidelines for crisis intervention. That includes mobile crisis, and mobile crisis is a huge focus right now. Supporting individuals in the community, being able to have crisis intervention intervene versus the police intervene, if that's appropriate. There are times where it's appropriate to have police involvement, but there's many times that it's more appropriate for mobile crisis to be involved if it's not a volatile situation. So being able to align with that, right now we don't have the staffing in crisis to be able to provide mobile crisis in that way. Much of our mobile crisis is happening because we have 2 additional hospitals in Cumberland counties, the UPMC West Shore and Penn State Health Hampton Center, that don't have a crisis site, but we are required to support those hospitals. So when someone is in crisis, they can go to any of the 4 hospitals, and then crisis goes to them. That's a lot of what our mobile crisis is doing right now, unfortunately. What the other piece of what the SAMHSA best practice guidelines look at is a team that's made up of a mental health professional and a certified peer specialist. That's not something we've done in the past, and that's something that will take some time to transition to be able to identify who meets the criteria as a mental health professional and be able to garner interest in a certified peer specialist to be able to be in that role. We haven't quite figured out how we're going to do all of that. I think it's going to be a in progress kind of thing, because they're wanting it to be the federal government wants it to be a 24/7. So we would need to really revamp how we're doing things and recruit individuals who might be willing and interested to be available 24/7 to do such a program. There is information about our crisis utilization in the plan as well that can be helpful to look at. Our third initiative is our PULSE, Preventing Unnecessary Loss Through Suicide Education. That's our suicide prevention initiative in Cumberland and Perry counties. And through that initiative, we are, as a grassroots effort, trying to provide awareness and education throughout the community. There have been a couple of events that have happened. Again, somewhat impacted by COVID. There was an event that was scheduled that we had to cancel, I think, last year, and then that was using the book, The Deepest Well, and that was to be a discussion about that. So we have distributed that book, and we have had conversation with different groups about it, but not in the way that we wanted to. There is a planned event, however, on September 8th that is showing the Resilience movie at the West Shore Theater, and that will be, My Ascension. I'm sorry, I apologize. My Ascension movie. It's about a 16-year-old girl who attempted suicide and her story after that. The trailer I saw is very powerful. So if you're able to see that, it can have a real significant impact on how you view that. And that is also sponsored by PULSE, by our suicide prevention initiative. And like I mentioned, our crisis intervention program became part of the National Suicide Prevention Lifeline. So that is a really great step in that direction. We also offer our Question, Persuade, Refer, Qpr trainings. And we had in the last calendar year, I just looked at that yesterday, 182 people were trained. We have a human resource staff member, Jen, who provides that training for our county mental health, our county staff. It's open to everyone. And then we also have a gentleman at the prison, Sam Cooper, who provides that to the prison staff. So that has been a great initiative as well to expand people's knowledge and awareness of suicide and suicide prevention and what they can do in the event that they interact either professionally or personally with someone who may be considering suicide. Our fourth initiative was to implement elementary student assistance in at least one additional school district in each county. Student assistance program on the mental health side has been available in the secondary schools for years. I think 30 some years, maybe 40 now. It has always been suggested that it occur in the elementary schools, but until the last 2 years hasn't been implemented there. Many of the school districts weren't really interested in that. So we have been able to, through our CATS coordinator, Megan, she has been able to work with the school districts and get the school districts to be trained in student assistance and what that means, and utilizing our CAS elementary-based workers to then also take on that duty in addition to their regular duties of CAS. And that has been very successful. There were actually 2 districts this past year that implemented it, 2 elementary schools districts that implemented it, and we have 2 slated to do so this year as well. So we will continue to work on that until all of the elementary schools have ESAP in their schools. And then our 5th priority is to support our county human service agencies in becoming more trauma informed throughout the counties. And that initiative has occurred in a number of different ways and will continue to occur. We have one of our early intervention staff, Amy, has been trained in providing the curriculum about becoming trauma informed, and she's done that throughout the county with various departments, as well as throughout the community and various entities there as well. The Deep as Well that I mentioned earlier by Nadine Burke-Harris, that was also distributed. And there is the Resilience movie that I mentioned earlier is also focused on trauma, and that is utilized in the CIT, the Crisis Intervention Trainings, again, to support a more trauma-focused intervention. And then our probation department, juvenile probation, has implemented the trauma pilot program that was a collaborative effort with juvenile probation, children and youth, and county mental health and community providers to be able to utilize a trauma screening and then follow that up with the trauma protocol in doing their intakes and working with juveniles. And my understanding is that there's also a project with the adult probation program that's going to be implemented this September regarding becoming trauma informed. So those are the 5 initiatives currently for on the mental health side. I don't know if you want to do questions after each section or you want to do the whole thing. That's up to you guys. Any questions about the mental health part? Okay.
I will ask my question. You mentioned earlier about how important some of the grants have been this year. And I'm assuming that those are not the regular grants. These are extraordinary occurrence grants.
Yes, limited.
How are they getting on our radar? Through the regular channels we have, or are there special just announcements coming out on those?
I think mostly those have been different staff getting announcements coming through and, okay, there's something we could apply for. Okay. And then trying to figure out, like I said, how can it be utilized? It can't be utilized for day-to-day work. So are there things like paying for overtime and additional staff for 911 so they can attend trainings? Are there things that, the purchasing the behavioral health works platform software? Are there things like that we can do that's going to make our services more effective, make what we're doing more effective and efficient? So that's how we've really been looking at that.
Are we confident we're capturing all of the opportunities that are out there?
I'm not sure that I would know how to capture all of them. I don't know that there's like a database that has every opportunity there. I'm not really sure. I think Annie reviews anything and I know that Brian, Megan, and I review anything that comes across our desk in terms of an opportunity. But I don't know that we necessarily receive everything. And the other piece of that, I just have to say, is that there are a lot of opportunities out there. I think the other thing to consider is that the staff in many of our programs and many of our providers have been through a lot in the last couple of years. And when we ask them to do one more thing, it gets overwhelming. Not that they're not already overwhelmed. So we try to manage that and see what we can do and how we being our office can manage things or maybe implement things to support our providers.
Just one other thing, and maybe I need to ask Annie this, but there had been some discussion before about the possibility of finally getting some formula changes with the legislature that might help alleviate some of the disparity between counties on the.
I don't know that has gone anywhere. I don't believe it has. My understanding from the legislators for this current budget season is they took about $100 million and put it into the Behavioral Health Commission. I don't know if that will be something the commission will look at. I would hope so, but I Right. Guarantee it.
Thank you. That's all I have.
Okay. I'll let you talk about IDD.
Thank you. Along that same line, our families have tried to hit that up, for a number of years as funding inequities, and have called them to task. And we did have a few of our legislators go to bat for us and try to figure that out. And they cannot find a formula. And when they talked to ODP on our side, ODP was not willing to change the funding formula.
Okay.
So
it's
we
the
have
same
gone,
list.
gone down that road as well. And have gotten nowhere. But there is definitely an inequity when Cumberland Perry, let's just talk about Cumberland, is like third from the bottom of all the counties, but it's one of the fastest growing counties. So there's something wrong there, but anyways. So let me talk about intellectual disabilities and autism. The focus for our part of the plan was to focus more in depth on the areas of service that will help individuals achieve the goal of an everyday life. So that's what we were to focus on. So the IDD system, as well as our Cumberland Perry office, believe that we should serve our individuals here in this county and not have to send them out. So we do our darndest to keep them here and not have to send them out to other counties across the state. We also believe that they should have choice and control over what they want to do, what kind of services they want. And we make sure that our providers are giving them that choice and control. So as you know, our program is a 2-county program. We house both the administrative entity and the supports coordination organization. We now have about 1,000 individuals with ID and autism registered, and that registration is based on a documented eligibility, as you know. The split between the 2 counties is about 80% Cumberland County, 20% Perry County. So it's been holding pretty steady at that. Services, sports coordination, residential services, supported employment, job training, other day programs, family support services, including respite, transportation, and recreation and socialization. So those are, some of the big services that we offer. Some of the strengths of our program have been our focus on competitive employment, as you know. One of our programs that we are very proud of is Project Search, which everyone hears me talk about a lot. But being able to teach those employment skills and have you guys involved in that is terrific. So far, we have 28 individuals have gone through Project Search, 21 have got jobs afterwards. That computes to about a 75% success rate. So we're happy about that because during the pandemic, we did have to stop the program for a little while. Overall, as of June of this year, 183 of our individuals, or 24% of them, are working competitively, which is really good. And today, we are able to say that 75% of our graduates are looking at an employment outcome, as opposed to 7 years ago, only 25% of them were looking at employment. So that is also really good. We have the opportunity for our individuals to attend post-secondary education programs through a program called the Dream Partnership. Some of the colleges participating in the Dream Partnership include Penn State Harrisburg, Temple University, Slippery Rock, Duquesne, Drexel, and there's others. And we have several individuals who attend Penn State Harrisburg, as you would expect, because that is closest. We did have some individuals go down to Millersville University as well. And Hack was in the program at one time, but they are no longer in the program. We also promote independent living and supported living. We have our Pathways program, which we started out in 2014, and it was to assist those individuals who wanted to learn to live independently in their own apartment. This program was developed because parents had a lot of concerns about having them live independently. So this program was developed as a 12 to 18-month curriculum-based program, so that they could not only be educated in the skills, but also practice the skills. It is their responsibility to take care of the house out in Thornton Springs with staff oversight. But they do the dishes, they clean the bathrooms, they run the vacuum, they do all those things. They do the own grocery shopping. So upon graduation, they get to move into their own apartments somewhere in Cumberland County, and we assist them in helping them get all the supports that they need in that area. And they are also given in-home supports based on what they need. Some may need 15 hours a week of in-home supports, and others may only need 5. But they are getting those based on their need. We have had 18 individuals graduate from that program. And we have a new class of 4 young ladies out there that began in February. And this house is located out in Thornton Springs. We also offer independent living technology, which is any devices, sensors, iPads, medication dispensers, anything like that, that's going to help somebody be able to live more independently. We do a lot of cross-systems collaboration with mental health, with children and youth, with aging. Some of the highlights there are we have a mental health ID mobile behavioral support team. We have a complex case team for children and adolescents that are involved in children and youth mental health and intellectual disabilities. We've been meeting a lot. That team has been meeting a lot because we seem to be inundated with a lot of complex cases right now. We do some collaboration with aging and also with the school districts. Some of the new services that we are going to implement this coming year would be our independent living specialist, is the person who works with the individuals and families who are interested in independent living. She does assessments and she, does some teaching. She helps them learn to be advocates for themselves in the community. And she helps them just along the lines of personal growth and empowerment. We have a new program, the Community Inclusion Center, coming this fall. It's by Vista. Vista is a provider of autism services from Hershey. The program is going to be located in Camp Hill. And this is specifically an autism provider. In one of my section back here on needs, you'll see that we need autism providers. So Vista is an autism provider. It is for individuals with autism to have a meaningful day and to increase independence, confidence, and overall quality of life. They will spend at least 50% of their day out in the community. So we're looking forward to that opening. And then one of our residential providers is currently renovating one of their community homes specifically from individuals with IDD who also have dementia. This home will have fully accessible bathrooms, kitchen. It'll have an open floor plan with appropriate lighting and color contrast to aid in supporting those folks with dementia. The Housing Authority is also helping with this project. We will add technology to help ensure the safety of the individuals. And one of the things to remember is that when we have an individual with ID who has dementia, they usually end up in a nursing home. So this is going to help that. And I'm hoping that once we get this home open and other providers see that maybe others can do the same thing, because we seem to have a lot of folks with ID who end up with dementia as well.
That's a good question.
Sure.
Is there an increased incident of that because of the extended lifespan now, or is it just we're just finding it now, or is it emerging?
I believe that it is emerging because our folks with intellectual disabilities are living longer, and we're seeing that.
It brings me to my next question, and I think it's buried somewhere in your overview. But for instance, I know we've had a lot of discussion about the lifespan for IDD. My sister was she was when she was born, we were told, my parents were told, she would not live to 30. She lived to 52. And my mother was nearly 90 at that point. And we've had a discussion before about the caregiver role being thrust upon folks and the lack of supports for that. Is that being actively addressed? Is that somewhere in this plan?
We do have this initiative called Supporting Families, where there are a lot of tools in there, and we start at 3 when they can enter the ID system. And there is different tools to help with the planning process up through the senior years. So it's one of the things that the SCs are being educated on. We have a specialist that's working out of the SCO who is specifically available now to help families with this planning process. So I think it'll help that. Our family transition coordinator, Cindy of the Reins, when we had her, she helped really into the planning. It hasn't been a role of the independent living specialist because we changed it slightly, but I'm thinking that we can pick it up with this Supporting Families initiative.
So that's part of the family support system.
Yes.
And that has seemed, correct me if I'm wrong, in the past, that seemed like it was an easy target for budget. In particular, the respite programs, very essential to families, I think had been cut at one point. I don't know what the direction on that
They
is.
are putting more money into respite, but respite is difficult because we need to find providers. That is the problem. We have developed a provider who offers respite, and it is always. They have 2 respite homes now in Cumberland County. They have 2 homes over in Dauphin County. This provider does, and the respite is always full. So we are trying to build respite, trying to find individual respite. We use these and see if there's any family members that want to provide, how to help to provide the respite. But it is a tough one to fund, to staff, not fund, because the funding is there.
Interesting. Thank you.
Mhm. So some of the other services to quickly close here are that Supporting Families initiative. We also have a community links website, which is an informational community participation type website that any family can access. It started out, it was only an early intervention website, and we decided that we needed to grow that and make it across the lifespan. So now it is clear up from early intervention seniors that there's all kind of information on there about specific educational topics, as well as what's going on in the community, who you can go to for this, who you can go to for that. So we get that website out there for our families to use as well. We also have our healthcare quality units, which is our nursing unit, which provides a lot of training and support for all health related issues. We had them on a provider meeting yesterday, and they gave an exemplary presentation on COVID and also monkeypox. So they're very good. They support our providers and they support families, and they can go out and assist with discharge planning from the hospital. So we are lucky to have them. Some of the needs of our system, of course, the staffing. Our providers did amazing work as well during the pandemic. They suffered greatly with the staffing issue. We have residential needs for individuals with challenging behaviors. We too are offering trainings on becoming trauma informed for our providers to try and increase their effectiveness and their competencies. And as I said before, we are looking for service providers for individuals who have autism. So those are some of our needs right now. Does anybody else have any other questions about the ID section?
One last one for Oz, one of you. So we talked a minute ago about the rise of the dementia issue, the emerging issue. So the mix of services needs to evolve with that.
Yes.
Our participation in the block grant is somewhat motivated by the need for flexibility. So how much flexibility do we have as that mix of service needs changes with the population? How much flexibility do we have to adapt to that?
A lot of the individuals who are being served in residential, most of them are being served through the waiver. So the waiver has a lot of rules and regulations.
Yeah.
Our base funding is not great in ID, but we have used monies that we have had left to do special projects with providers. And this is one of them. So we try to, at the end of the year, if we have money left, say, okay, this is what we would like to see happen. Anybody have an interest in helping us? So we are able to do that now, where we couldn't do that before. So we get some flexibility there.
You said before the block, right?
Yes. So we are happy for that. I have a little bit more flexibility in the base than I used to have now with the block grant. So I can use some of my base dollars there as well.
Thank you.
Okay, thank you.
Commissioners, for drug and alcohol, our budget situation is both similar to MH and ID. We're receiving flat funding with the state budget that was just passed. But we are in better shape because, as you know, for a few years now, Pennsylvania has received additional federal funding to address the ongoing opioid health crisis. And that additional federal funding has allowed us to do a number of different things. And that federal funding will continue as well. So we're not in dire straits as our colleagues. Our top priority for the new 22-23 fiscal year remains the same. It's to continue focusing on the ongoing opioid health crisis. The information at the national level continues to be quite dire. The CDC announced its estimates of overdose deaths for calendar year 2021, and it's over 107,000 nationally. The first time we ever broke 100,000 in a calendar year. It's a 15% increase over 2020. Each year it continues to increase. Those figures translate currently into about 295 Americans dying every single day from an overdose fatality. And most of those now are related to fentanyl, the illicitly produced and distributed fentanyl. In Cumberland County, we're doing a little bit better than the national stats and the state stats. We also saw in Pennsylvania an increase in 2020 and another increase in 2021 in overdose deaths. In Cumberland County, in 2021, there were 51 overdose fatalities. That was actually a 25% decrease in 2020. So we're trending in the right direction. 51 deaths is nothing to be happy about, but it indicates that there's still a good bit of work to be done. But at least we are moving in the right direction. With a lifting of the mitigation strategies that were necessary to keep us safe during COVID, I think that's contributed greatly because people were able to return to in-person counseling sessions, in-person support group meetings, and that's what's needed. Social isolation is the opposite of what somebody in early stage recovery needs. So our strategy for addressing the opioid epidemic has been multifaceted all along. We recognized years ago that there's no simple solution. And the strategy involves continuing to reduce the oversupply of prescription opioid medication for communities, increasing access to naloxone, the overdose reversal medication increasing access to drug and alcohol treatment in general, but especially the 3 forms of FDA-approved medication-assisted treatment for somebody with an opioid use disorder: methadone, Suboxone, and Vivitrol from naltrexone. Continuing community education and primary prevention efforts and early intervention efforts, and then continuing strong drug enforcement. Our department's mission focuses on the first 4. We're not in the business of drug enforcement. We certainly work in collaboration to support the efforts of our law enforcement colleagues. So we will continue to focus on the first 4, especially though on increasing access to treatment, continuing to increase access on naloxone and on prevention efforts. We think that the medical community has done a pretty good job of reducing the oversupply of prescription opioids. Prescribing practices have changed dramatically in the 5 years of focusing on this. So with increasing access to treatment, again, we're relying heavily on the additional federal funding that we're continuing to receive. And that's allowed us to greatly increase access to treatment across the board, especially to those different forms of MAT. One example of that is the Vivitrol that we have at Cumberland County Prison. That's been funded with a grant from PCCD. However, during the pandemic, prison population dropped, and we didn't need to utilize all the money that was in that grant. We were able to ask for and receive a 1-year cost extension, and more recently, a second 1-year cost extension. So that program, which is showing positive outcomes, is able to continue. This additional 1-year cost extension will probably allow us to continue the program about 6 months into the new fiscal year. And then our department is prepared to pick up the ongoing costs because it is a beneficial program. The other thing that we've been doing to increase access to treatment is several years ago, we started contracting with Just for Today, Recovery and Veteran Support Services in Illinois to provide warm handoff services to the now 4 hospital emergency departments in Cumberland County. And they have been able to do that consistently. Anyone who shows up in the emergency department as a result of an overdose or just presenting with a substance use disorder that's involved with their medical issues, the hospital will call JMT 24/7, and they'll dispatch a certified recovery specialist to go and meet with the person and attempt to do a brief intervention and referral to treatment. Since JFT's begun that service, they started in December of 2018. They've met with 915 patients. They were really convinced over half of 56% to agree to accept treatment. You might think, well, 56%, there's a lot that are refusing. But if you've ever worked with somebody with an active substance use disorder, you know, a hallmark is denial and resistance to accepting help. So we're actually quite happy with JFT's that encouraging. We want to continue emphasizing the importance of having naloxone readily available. Commissioners, you identified Penn State Lifeline Health as the coordinating entity for distribution of naloxone. We identified them several years ago when they were part of Holy Spirit and Geisinger Holy Spirit, now they're Penn State Health Holy Spirit. But it's still the same EMS agency. And they've done a nice job of continuing to take advantage of the free supply of naloxone that's available from the state and distribute that to first responders, our EMS, ambulance providers, to police. For several years now, all 16 municipal police departments have trained and equipped their police officers with naloxone. And a lot of times they're the first ones on the scene. We're continuing to supply naloxone. The standing order for naloxone expanded the definition of first responder to include all of our drug and alcohol treatment and recovery support providers. So they are also providing that. And for a year and a half now, Cumberland County Prison has been offering naloxone to those individuals who come into the prison, and upon admission, they need to be detoxed from an opioid substance. They're offered naloxone upon their discharge. So we're happy with that. We're also very pleased we contract with the RAISE Project, another recovery support provider, to offer community naloxone training. They've continued to do that in the height of the COVID pandemic. They were doing it virtually. They're back to offering in-person training sessions. This summer, they did a neat partnership with Foster Library. And each month, they offered one of those community naloxone training events.
That's just the supply availability good.
Yes, they continue to get their free naloxone from Dwayne Nieves of Penn State Lifeline. We're all using the same source to get that naloxone. And then we want to continue to emphasize school-based efforts. Our prevention unit does a lot of evidence-based programming. That schools went virtual. We did pivot and learn how to present virtually, but it's a lot more satisfying, a lot more effective to be in the classroom doing presentations. And it took us years to convince a number of schools to take advantage of the evidence-based curriculum that we were equipped to present, because it's a significant time commitment out of their curriculum, out of their school. But it's taken hold to the point where our prevention unit is having trouble keeping up with the demand for the services. So we're pleased with that. We continue to place a strong emphasis, particularly at the secondary level, on student assistance and intervention programming. And one of the particular issues that we're focusing a lot on these days, and we've introduced a new evidence-based curriculum to address this as well, is vaping. Vaping is greatly increased among young people, and that's a concern. We had seen lots of progress in reducing tobacco use, but now vaping is used to consume tobacco and other drugs as well. So we're concerned about that. We also have a challenge, as the other human services do, with recruiting and retaining qualified staff. And so that will continue emphasis. And we want to continue to strengthen our recovery support services, because it's great when somebody is in treatment and complete treatment, but we know now from research that it's actually similar to cancer. If somebody is able to sustain their recovery from a substance use disorder for 5 years, their chances of sustaining that for a lifetime are much better. So we are trying to build in our communities in Cumberland and Perry County supports that allow people to continue to support their recovery long after they complete their treatment. And so that's a new focus. Questions?
Yeah, Jack, you mentioned Vivitrol, that you have a plan to keep that program going. Vivitrol, from what I can tell, has been very effective. I know it's expensive. By chance, is the price of it coming down? And I don't know if you know this or not, because I don't, but the recent federal legislation that was signed and passed, there was a piece of that targeting the cost of prescription drugs. Vivitrol possibly fall into that
That's a
category.
very good question. I don't know.
Yeah, I don't know either, but I just thought I'd bring it up.
I thought that the piece in that new legislation was focused more on Medicare.
Yeah, you're probably right.
So I don't know that it will affect, but, no, the price is not coming down. It fluctuates a little bit depending on things that develop each year. We do manage to get preferred prices by working directly with, well, we work with Prime Care, the medical provider in prison, because of the volume they need. They're able to qualify for better prices, slightly, still quite expensive. It's a monthly, it's an injection that's good for a month.
Thank you.
Thank you.
The other two pieces, Annie, I thought she was going to be here. Is she on, or not?
Yes,
Okay.
I am here.
All right, great. Thanks, Annie. Go ahead.
So for homeless assistance programs, we aren't making any significant changes in our funding distribution for homeless assistance. There is a new emergency family shelter. Community Cares Family Shelter is open in Shippensburg, which is meeting a need for shelter in that area of the county, and it allows for family rooms, providing for the basic needs, weekly case management, and collaborating with local organizations. For HSDF, we did add a line for home delivered meals to help pay for temporary emergency meals, usually to bridge a gap in services. Cumberland Cares for Families, which is in conjunction with children and youth, is growing. We do foresee the need in the future for additional staff in that program, but for now it's going well, and that position is supported by children and youth. We are working on getting Echo Housing up and running. Echo Housing is a small temporary cottage placed on the property of a family member or friend who has the land available. They maintain their independence but have nearby supports as a housing solution and an alternative to homelessness, or depending on their level of care, placement in a personal care home or a nursing facility, or having to live in the family's home. Meetings and service coordination includes representation from aging, community services, housing and redevelopment authority, planning commission, and mental health. So we are working collaboratively to get that off the ground. That's pretty much all I have to report. There aren't a lot of changes in that area.
Thank you, Annie.
Thank you.
So that concludes the presentation of the plan itself. Like I said earlier, I think we have a number of folks who are interested in giving some testimony. So, Angie, I know that you have an appointment and you'd like to go first. That's welcome to.
Do I just?
You're good. You're good, dear.
So
Could I-
mental health treatment.
I'm sorry.
One thing, we typically, I guess it applies here as well. We really would ask you to give your name.
Okay.
And maybe
My name
if you're
is
affiliated with an
Angela.
organization or from a municipality, something that apply.
My name is Angela Parashini. Mental health treatment saved my life. Let's start off by saying that I've been getting mental health treatment since I was 15 years old. I'm now 35. I wouldn't be 35 if it wasn't for mental health services that was provided by Cumberland County, especially New Visions. I've had many ups and downs, times where I've been hospitalized, times where I've even been at the state hospital, many times actually. I've also been at the EAC, which is an extended acute care, when they were more available. I've been home several times before moving independently and trying to do it on my own, but even then I depended on mental health resources to stay afloat. I am now one of the lucky ones that is in a new program in Carlisle by New Visions, the LTSR in Cumberland County, which is the long-term structured residential program. I feel very blessed to be in this program. I feel bad there isn't more places and resources out there for people like me struggling. There are so many people untreated and not able to find resources in Cumberland County. I'm one of the lucky ones that have support. We're short, we really need to put the funds where they're really needed. Mental health may not be always visible, but there's many people struggling every day, just like I do. At times, children, teens, and many adults need services provided by Cumberland County. And I can tell you firsthand that I would have been dead if it wasn't for mental health treatment, new visions, and the resources that have been provided for me since I was diagnosed severely mentally ill. To whoever's listening, like I said, you can't always see mental health illness, but some days I struggle to even get out of bed, eat, or keep a daily routine. I need help. I'm okay asking for help, but if there's no one to ask for help from, where do you go? This is why the budget needs to be increased, because you're saving lives. Thank you. I have to go.
Okay.
Thanks.
Thank you for sharing.
Thank you.
Good morning. My name is Louis Bianco. I'm a 39-year-old lifelong resident of Cumberland County. At age 15, I was diagnosed with a mental illness. I was not expected to graduate high school or college. However, with the help and efforts of numerous teachers and psychiatric professionals in this area, I did. Ultimately, I became a nurse and soon found myself working within the very facilities that I was a patient in throughout my life. I ascended to the role of charge nurse on child, adult, and geriatric units, while also serving as the lead crisis de-escalator of the Pennsylvania Psychiatric Institute. However, once more, my illness showed itself to be stronger than my recovery, and I had to resign. A number of years later, I reinstated myself into our mental health system as a certified peer support specialist at the Holy Spirit Hospital on a 2-year grant. I was tasked with creating an evening shift peer specialist position, and this position has since been added to the budget of their inpatient facility. All of this is to say is that I have been on both sides of the proverbial glass. I've taken countless medications, some effective, some not, experienced extreme financial distress, suffered through over a dozen of electroconvulsive therapy treatments, as well as multiple inpatient stays. I have also worked as a professional with people, young and old, rich and poor, of every race, religion, and any other designation that one could imagine during the most difficult experiences of their lives. Mental health crises and the fallout that occurs in the time after is very hard work and requires the ability to adapt and adjust, as well as compromise and sacrifice. The choices many are faced with have little to do with what is easiest or most preferable. However, difficult is not synonymous with impossible. At this moment, I am unemployed and on disability due to over 2.5 decades of living with a mental illness, relying heavily on the mental health system and governmental assistance. I have also developed a neuromuscular disorder due to years of extreme stress and demanding treatments, but still I serve my community. As of now, I am the MH chair of the Cumberland Perry MH-IDD Advisory Board. I do healthcare assessments monthly with Holy Spirit's intensive outpatient consumers, and will be doing healthcare assessments for their staff as well at the end of this month. I have secured part-time employment at York College, working with their nursing students to increase their mental health care competency through simulations as a standardized patient. I spoke at a statewide conference for physical education teachers, discussing the need for K-12 curriculums and even sharing the early creations I have designed. I also spoke to future police, lawyers, teachers, and nurses at a number of colleges in Pennsylvania and helped organize and participate in Cumberland Valley High School's first ever Wellness Summit. I recently published my 3rd book in 3 years, aimed at getting basic information on mental wellness out to our communities as quickly as possible in hopes of strengthening our community during what can most basically be described as a shared trauma and shared crisis since the onset of this pandemic. Information on wellness should not be reserved solely for those in crisis to help them out of it. It should be shared with the healthy in hopes of avoiding crisis altogether. I hope that within this brief period of time, I have established enough credibility to stop talking about myself. This is not about us as individuals at this moment, healthy or ill. Our community, our state, and our nation is looking directly at a looming crisis, with many areas, including this one, already facing challenges that threaten the well-being of our entire populace. The demand for mental health care continues to increase across all demographics, while the supply continues to dwindle. It is becoming more and more difficult to keep our facilities adequately staffed because of reasons such as dissatisfaction with wages, safety concerns, and morale, to name a few. The same can be said about the educational system, and the same can be said about the criminal justice system. It appears that there is not enough intrinsic motivation or incentive for service, and this is a concerning reality. Present company excluded, there are many people in this room who continue to devote their time and effort to these causes. Specific to mental health, the ratio between doctors and consumers is rising at an unprecedented rate. The wait time for many to receive the treatment they require now spans from 6 months to over a year, depending on your insurance, not to mention the continuously disturbing rise in suicide attempts, suicides, overdoses, and crisis calls. Currently, the overall stress of everyday living continues to increase due to numerous factors, and this puts us all at risk. The ill at risk of remaining sick, the healthy at risk of becoming ill. This is why our approach moving forward must be twofold. Not only can we focus on healing the sick, we must also focus on protecting the healthy. If we lose those who are still willing to serve, we will not be able to face what is coming. Recovery for the mentally ill is not guaranteed. It requires accountability and massive amounts of effort. Even during the lowest times of one's life, the demand is placed primarily on the individual suffering. In this sense, our community at this moment is no different from any individual in crisis. Whether this hearing or any others yield the desired results, service will remain necessary. The lost will still require guidance. Those in pain will still require care. Those at risk will still require safety. Proactive measures in our community require as much attention as the maintenance of the facilities and programs that currently exist. I am aware that all of our systems are failing and thus not demanding anything other than time and effort moving forward. Yes, the long-term solution of our current circumstance requires finances and governmental intervention, but what of the short term? This is a serious issue that requires serious attention in the now. It is time to put our psychiatric experts and consumers in the same rooms as our other service professionals and government officials. I believe in our community and the state of Pennsylvania. I am a product both positively and negatively of the systems that we are now fighting to keep afloat. We can do this even if it continues to get worse. At the peaks of my illness, I was told to maintain hope. As a professional, it has been my duty and my privilege to encourage those suffering and their families to do the same. If we are asking our ailing population to foster and nurture hope and be resilient, I must continue to ask you all to do the same. Regardless of circumstance, recovery will be ours to achieve together. Thank you for everything you have done and continue to do for the sake of our mentally ill and the mental wellness of all.
My name is Laura Jessica. I work for American Behavioral Health here in Carlisle. I operate 6 programs that serve adults in both Cumberland and Perry counties, but the base is here. The services we provide are separated into 2 categories. One set is a set of services that help people reach the valued roles that they want in their living, learning, working, or social life. We help people through skills teaching and support reach their full potential after being diagnosed with a serious mental illness. We help them to move on in the community and, more importantly, the outcome of improved quality of life, which we've heard a lot today. The other set of services is a peer-driven service. We have certified peer specialists, a common ground program, and a warm line, all served and staffed by people in recovery. The goal there is to offer hope, as we heard, and the feeling that you're not alone, that you can learn to cope and navigate our current service system and be able to work with their medical professionals to overcome their diagnoses. Over the years, we've had the wonderful opportunity to be funded by the County Mental Health Office for the majority of the services I described. They devoted funds and immense guidance and support to giving those in our community with serious mental illness a chance to become employed, to have social connections they may not have found or had access to increase their community integration and be part of the community we're all in, and to obtain the invaluable peer support. When a person may feel unheard by everyone in their lives, we teach them how to use their voice and get their needs met. We provide psychoeducation so they understand their illness and prepare them to use the service system to meet the needs they have. The county mental health office has fully funded our warm line, which is a telephone service that operates in the evenings and weekends when the regular service system and other providers are not usually available. Those in recovery staff the phone lines, understand, and they're on the other end of a phone call that's easy to make. That service has always been dreamed to be a 24/7 service, but the hours are quite short, and it's due to staffing and funds. They've also 100% funded our evidence-based supported employment program, where we serve upwards of 60 people at a time. And we see the employment rate amongst those people of 65%. That's not a one-time statistic, that's our average throughout the last 2 years. We teach them how to get employment and help them maintain their employment. And without full county support in 2008, when we began this service, and their support to keep it going, over 350 people wouldn't have thought that work was even an option for them due to having a serious mental illness. The other services we operate have MA funding. Medical assistance is the primary source. The county mental health office, as Robin mentioned, has always been able to fund those who are not eligible for MA. The flat funding that we've experienced for over 10 years continues, and I fear that only those that meet the requirements for medical assistance will be able to access these valuable services. So that means that people who have Medicare or are on their parents' private insurance, or those who are working and their income is just over the limit, will no longer be able to access the services I'm about to describe. So one of those services, psychiatric rehabilitation, which happens in what's like a community center. So it's also a place to belong. We serve over approximately 120 people, both here in Carlisle and our new location in Newport. The members of the program may not at this time have the skills it takes to obtain the roles that I mentioned before, because parts of their lives were taken away from them due to the emergence of their mental illness. They want to have valued roles such as homeowner, be a better sister, mother, parent, or friend, and they need the skills to do so. They may want to go to college, complete their GED, or simply join a local community group and aren't comfortable doing so without our support. However, they may not have the skills, confidence, and problem solving. We are there day to day to help them when those needs arise. There's no question that COVID-19 pandemic has impacted our population. It's limited their access to the social connections, which is such a healthy part of our life, as we all know. They've come back to our center, sometimes more symptomatic and with the need to rebuild the skills that they didn't maintain during the time they were isolated. It hasn't impacted over the 200 people we serve, but it's also impacted staffing, the health of our employees, and the cost of service provision. The amount of support needed by those in the community has only grown. We've heard that today. The rehabilitative services that are making an impact on people's lives, they're non-clinical, and we want to teach and sustain these skills and be there to support them. Even with rising costs, we would not be able to, it's sort of the deficit, we won't be able to improve our offerings. However, we have an opportunity to expand our age service to youth and young adults through both our peer support program and our psychiatric rehabilitation program through state initiatives. We have a licensed peer support program that could serve ages 14 to 17, and staffing, specialized training, and providing service at different hours is unable to happen at this time. We have reached our limit and it is expensive. There isn't going to be an easy way to expand that to also our psychiatric rehabilitation that could help transition age youth move on to a productive life instead of getting on Social Security and other government assistance, if we can't find a way to expand to fill that initiative by the state. Rehabilitation and recovery, as well as creating resilience, is very much needed. Without an increase in our resources, these services may not continue, and they certainly won't expand to meet the need that I had described and has only increased in the recent years. I'm also a member of the PULSE Suicide Prevention Task Force, which is making an increased strides every year with a lack of increase in support and funds. We educate the community and spread the word through many of the ways was described today. It's a small and mighty group of volunteers. And what is really interesting that's happened is a group of survivors of suicide who offer support more and more. Again, that's the peer support. The task force has very devoted volunteers, but again, with manpower low, it's hard. We use every bit of funds that are set aside for the effort, but it could always be more, and we could reach a larger audience, making a larger impact in our community. If you could help us help those struggling with serious mental illness become the citizens that they wish to be, we would greatly appreciate it. Thank you.
Thank you, Bob. Hi there, good morning, commissioners. My name is Jennifer Wilt, and I am here to represent an organization called NAMI. I am both a family member of a son that has a diagnosis of schizophrenia, substance use disorder, and autism. And like I said, I'm representing Cumberland Perry NAMI. NAMI is a national organization that represents families of individuals with mental illness and mental health challenges. NAMI stands for National Alliance on Mental Illness. And just so you know, just keep in mind, 1 in 5 people, 1 in 5 suffer from mental illness. So we provide information, support, advocacy to families, individuals with mental illness. We are all volunteers in Cumberland, Perry County, and in Dolphin and New York. They have some paid positions, but we're all using our extra time. I actually run a business. First, I want to recognize Annie Strite for her tireless efforts in supporting mental health services in Cumberland County. Her passion and commitment to the work is appreciated. I also want to recognize many of the strides that Cumberland County has made in working across systems and counties to maximize resources. The investments in Capstone, the early psychosis program, supported employment, CIT to support police. I've actually done a presentation about our story in front of CIT classes, suicide prevention, and supported housing. That all demonstrates the county's forward thinking to ensure the best practices are implemented here in Cumberland County. Having said this, however, there is still much to be done. These past 2 years have been extraordinary, and despite best intentions, have left many individuals and their families without access to needed resources. Access to services has been challenging. Long waits in emergency rooms. You can sit for 3 to 4 days before a bed can become available. Extended stays in jails due to lack of appropriate housing. They're sitting there waiting for a place to go. These are extended or residents and having the appropriate housing or residential care, and grave concerns about workforce. Not only the numbers of staff, but their commitment and competencies have many of us feeling very unsettled and concerned for the well-being of our loved ones. We, NAMI, agree with the focus on workforce and funding in the plan. We are in a crisis. We hear the continuous stories. I teach a family-to-family course. Last spring, we had 26 people show up for our class. That was really amazing. And it's telling that people are coming out and want to be educated with what is going on with their loved ones. So we hear it front end, you know, these people that can't find places to go and that are homeless. There's long wait periods to get support, as you had mentioned, 6 months to a year to find a psychiatrist, or even just get into a service, find a caseworker, because the county doesn't have the means to hire the staff. We must have incentives for staff, grow our own through additional support of peer services, both family peers and peers of individuals with lived experiences, and provide hand-on training to ensure we have qualified and competent staff. Overall funding is also needed. The lack of support for funding for the county is irresponsible, especially in light of what we have seen as a significant increase and needs post-COVID-19. And in our county, as the fastest growing county, the needs of our community members. One-time funding should be invested in training and housing to launch programs. But sustainable funding is a must. Finally, despite the efforts of the county, housing resources remain inadequate. Supported housing can only be successful if the supports are available, and community residential settings are sparse throughout our county. We also need a greater emphasis on co-occurring treatment. It's wonderful what you guys have put in place, but I am also familiar with, we say dual diagnosis, you go into a place and they look at one side of the spectrum. It's got to be working together for it to work, because as we also know, a lot of times there's substance use disorder along with mental illness. You can't continue to look at them separate. NAMI's here to be a partner in this work, but we also challenge you and us to do a better job. I do want to make everyone aware that NAMI is having our first annual walk, October the 8th. I would love it if everyone here showed up, made a presence. We have 40 peers from the county, group homes are bringing them in, and we're starting to trickle in with this. But unless we start making a force, speaking out, talking, I'm starting to collaborate with York County NAMI. We're going to be heading to the Capitol in May with a group of us to tell our stories and to fight. But we need letters, we need all kinds of things. That's the only way something's going to happen. So I appreciate you letting me be here to talk and listening to your stories as well. Thank you.
Thank you, Jen. I don't know if there's anyone else online that was, oh, I'm sorry. Did you want?
Yeah, if you're okay with that. So I'm Brian Curtis, Lieutenant with Mechanicsburg Police Department. I wear many different hats within the police department. I've been going into the schools for 22 years of my career, doing kindergarten through 12th grade education. Most of it trying to be preventative through DARE programs and stuff. I also sit on our county CISM team, which is Critical Incident Stress Management team. I'm a CIT trained instructor, so I actually instruct the classes for Cumberland County. I also go into the academies at HAC for the local municipalities for training on special needs, as well as talking about biased training, so diverse training as well. I've most recently been involved with Dauphin County CIT and going to do the bias training as well. I'm also a crisis negotiator for the county special response team, as well as a trauma-informed instructor as well for policing, which is obviously a big push. We've kind of heard a lot about that. So I also work the streets on my free time, I guess. So I consider myself to be a working lieutenant, and the fact that I still cover shifts and still do the calls. So I'm on the first line of that. At this point in time, we still have no idea what the pandemic did with COVID to our mental health for our communities or our substance abuse. At this point in time, we're just now kind of starting to actually get back into the schools really opening up. And I think we're going to unfortunately see a large increase in the mental health calls as people start to get out and about again. A lot of people were home suffering in silence because they had no place to go, no place to talk to. A lot of the calls that we get now are related to mental health or substance abuse in some way. The resources that we have to be able to do that is one place, jail. And unfortunately for mental health and substance abuse, that's not the place for people to go. If anything, it actually increases. If you talk to anybody that goes to the state prison system, the availability of drugs is actually higher in the state prison systems than it is on the streets. It's almost easier to get drugs in there. The trainings and the treatment that they get there is minimal, especially in the state system. We need to kind of push more towards getting there, because at the end of the day, no matter what we do as police officers, we like to think that we fix problems, when in fact all we do is just put a Band-Aid on the problem. We put a Band-Aid on it and then say good luck. When you talk to the people asking them what services do you have provided to you, a lot of times they laugh because they either can't afford it, don't have the insurance, or it's unavailable. Someone that's in crisis is usually when we meet them, and that's on their bad day. There was a time within this year, this calendar year, where Holy Spirit Hospital was on crisis divert for the better part of a month. because mental health was, and crisis issues were so bad at the hospital that they just didn't have the place to put the people. So where do they go? You know, we just kind of basically say, okay, fix your problems on your own, or try and call and get services. Through everything that I've done recently within the crisis intervention, you meet this group here. And for them to be able to be doing the jobs that they're doing out there with the funding being flat, I can't imagine just in a place of my own at home where someone would say to me, do more with the same. Over 10 years, the more that they're doing with the same. Grants are beautiful. And, you know, within law enforcement, we've done a lot of grants, but if anybody that's ever sat down to write a grant, it's an investment. You're not only investing time and efforts into that grant, but once you get the money, the work on the grant doesn't stop. You have to then continue the work to be able to prove that the money's going where it needs to go. I think that the money is better served to be able to be put on the front end, because at the end of the day, it's an investment. You're investing in your communities, because if you can make people better and treat what their issues are, then you're investing in them, and they can basically move forward to do what they can do, and they're not suffering on their mental illness or their substance abuse, and also committing crimes, doing bad things that they don't want to do. Nobody wants to be a mental health person. Nobody wants to be addicted to drugs. It's just unfortunately with the life that has been chosen for them, and they want to choose a better life for themselves. So I would just, you know, push on that. Is, you know, we're seeing it every day there, and the resources are out there. Unfortunately, they're just, everybody's fighting for little resources, and we need to provide more resources. And the folks that you have here that are working on the front lines, I applaud you for the efforts you're doing, and thank you for everything that you do day in and day out. And anything that I can do personally or professionally, please let me know. Because at the end of the day, I am also a father. I'm also a cousin. I'm also a grandfather, an uncle, and my life has been touched personally through my family by suicide, substance abuse, and mental illness. So at the end of the day, I'm not only investing in my community, I'm investing in my family as well. Thank you.
Thank you. Is there, I don't know if there's anyone online.
There's two people, there's a Beth McAllister,
Okay.
and there's a Barry France.
Let's start. Ms. McAllister, did you wish to address the group at all?
No, I don't have any questions, but thank you. I've been listening intently. I'm from Marikey, so I wanted to support my staff that are there today, and thank the commissioners as always for their support.
Okay, thank you for attending. Who was the second?
Barry France.
Yeah, he's for the letter of support for the.
Oh, okay, so that'll be Mr. France. We'll come back to you as we have our meeting coming up next.
And I have one more letter to read. Carol Thornton from the Partnership for Better Health. She was not able to be here this morning, but provided me with her comments and asked if they could be read during the hearing. Good morning. My name is Carol Thornton, and I am the Director of Grants and Public Policy at the Partnership for Better Health, a local health foundation that champions and invests in ideas, initiatives, and collaboratives that improve the health of the people and communities in our region, including Cumberland County. Thank you, Commissioners Eichelberger, Fasci, and DiFilippo, for this opportunity to offer comments on the draft Human Services Plan for Cumberland County. Our organization appreciates each of you for advocating on behalf of the county for MHIDD services today and throughout the year. The partnership values the persistent efforts of the Cumberland Perry MHIDD office in ensuring access to services that support people of all ages with serious mental illness and intellectual and developmental disabilities. The agency's leadership has always been open to collaboration in addressing community needs and has been an exceptional partner in local coalitions and partnerships, such as housing, health improvement, resiliency efforts, and crisis response. We know that suicide is the second leading cause of death in Pennsylvania for people ages 10 to 34 years old. In Cumberland County from 2019 to 2021, there was a 29% increase in 911 calls that were coded as psychiatric, compared to a 4% increase in overall 911 calls. Suicide deaths in Cumberland County nearly doubled, increasing from 14 to 26 between 2019 and 2021. And rates almost tripled in Perry County, growing from 6 to 15. The populations of Cumberland and Perry counties have grown by more than 10% since 2010. However, the Cumberland Perry Mental Health Office has not had a budget increase by the state in over 10 years. And amidst the rise in annual insurance, salary, and related operating expenses, the agency has successfully contained administrative costs to less than 6% of its budget. But the demand for services continues to increase, despite fewer financial and staffing resources to meet the demand. Between 2019 and 2021, the number of individuals in Cumberland and Perry counties receiving county mental health services increased by 15%. Counties provide essential community-based mental health services, such as community residential programs, family-based support, outpatient care, and crisis intervention, which are critical to the well-being of our communities, especially for those without adequate insurance coverage. The Commonwealth needs to strategically invest funding into county mental health services to support the existing safety net and increase the availability of services, including this block grant and other funding streams such as county-based services. The partnership also commends MHIDD for its ongoing efforts to address youth mental health. The 2021 PA Youth Survey was recently released, and the findings were sobering. In Cumberland County, 33% of surveyed high school students in grades 10 to 12 reported feeling depressed in 2021. Further, 11.7% of all surveyed students in grades 10 to 12 reported following through with one or more attempts. In 8th grade, there are further indications of youth mental health concerns. Fortunately, we have a strong student assistance program as highlighted in the Human Services Plan at the elementary and secondary levels, but there is much more to be done for the future of our youth. We stand ready to support the county, MHID, our communities, and school districts to implement interventions to address and prevent mental health issues among our students. Given community needs at this time, the Commonwealth must allocate more funding to mental health services. The Partnership for Better Health supports the efforts of the MHIDD office as presented in the Cumberland County Human Services Plan for 2022. We urge the Commonwealth to revisit and address its current funding allocations based upon hearings like this one today and the accompanying submission of written statements. Cumberland County needs more resources to fully address the mental health needs of all residents. Respectfully, Carol Thornton, Director of Grants and Public Policy. And I think that's the end of the testimony. All of these testimonies will be provided in the plan in a written form so that they can be submitted with the plan as well. Any other questions about the plan at all? Or anything that's been presented?
Questions, comments?
Thank you.
I will just make a comment. So, you know, I started in 2019. That was my first exposure to this particular hearing. And every year since 2019, I've heard this discussion about flat funding, and I know we're on our 11th year of flat funding. But this year, it is disturbing to me how tired all of you sound. Really tired. And so, you know, we do our best at the county level to deliver these services, but as so many people testified today, if we do not have better state funding, we will not be able to meet the need. This will not get any better, and it touches every aspect of our society. And I know that you said 1 in 5, was it 1 in 5 families, right? I think it touches all of us. Mental health issues touch each and every one of us. Substance abuse issues touch each and every one of us. And Mr. Bianco, I'm so glad to see you here today. And I was thinking about you when Mr. Carroll was talking about getting into schools, right? And getting into these early education programs. So I'm so glad that you came today and spoke. It's really important. But I mean, that's just my commentary, and I wish I had a wand because I would make it rain.
I just a comment to that. I think that we were all very hopeful when the governor's budget included a significant increase for mental health. And we're very devastated when that increase was gone to some type of commission that's going to be developed and decide what's going to happen. So I think we were all very, very disappointed.
So, I want you to know this, and Stacy and I have been working on this for maybe 2 days, because I did not know about this until 2 days ago. I am having a conversation with Senator Casey. I'm meeting him in Harrisburg at about 12:15. And he wants to talk to me about what infrastructure needs Cumberland County, requires, and this is at the top of the list. There's no way around it. It has to be addressed.
Thank you.
That's it, that's all I have, but thanks for your work. You just all seem tired.
That always sounds that way. Actually, 18 years, that sounds that. I just have one last little bit. So I really appreciate everybody being here. This has been the most engaged of these hearings that I can recall in some time. So, and this is great information. I mean, we regularly receive updates and briefings from all of our superstars and Jack too. But to actually have the opportunity to hear from advocates and consumers and such really puts that fine point out. And I'm want to forgive me, I don't remember everybody's names. I remember Lieutenant Curtis because he was ticketing on my wife's car. But all of you being here today is really super important. And I don't want to leave anybody out. NAMI is a great organization. We've got a lot of people who are volunteering time for essential things. And it's got to be, to say that it's a difficult situation is the understatement of the decade at least. So Mr. Bianco in particular, though, I do want to mention that's a terrific story. And I hope we are, putting you to good use in communicating I want to thank you all, and on behalf of everybody, I want to thank you for your commitment, not only to your own recovery, and it is a commitment to undertake that, not only yours, but also to others in the community. Those are extraordinary efforts that you outlined for us. And that's, and I found your comments to be enormously forward-looking, well beyond the moment here. And I know that can be really difficult and well beyond your own situation as well. So that really resonated with me in particular. But we appreciate all of you being here today and giving us, some useful and important perspective on what's going on. I have one quick question for you ladies. A number of years ago, we went through the whole episode with the closure of the state hospital, and the state made all kinds of promises to us on that being a successful transition. I don't want to put you on the spot. Nobody from the state's listening. So what grade would you give the state for its handling of that situation? And if you don't want to answer, it's okay.
I would say initially they did an excellent job in supporting the counties. I would say since that time, in the last, because that was the state hospital closure was 2005. Okay.
Wow. Yeah.
So that was 17 years ago. But obviously in the last 10 years, 11 years since we did go through a budget cut, and then it's been flat funded since. It'd be a D.
In my recollection, when they came up with additional funding, they promised that money would be there in perpetuity.
In perpetuity.
And then a few years later, they cut it by 10%.
And we actually looked out because Dennis was successful in getting a little extra kind of off the books money. Talk about that. We were able to use it for housing options and such. So, but others, that's not been an ideal situation. So. We have a very full schedule, so we still have to get through our meeting. So I don't want to put anybody short, but again, thank all of you for being here, for the great amount of work, the hours and weeks that went into this. We appreciate it very much. So, and with that, we will need a motion to adjourn.
All you need to do is chairman is close the public.
Right here. Okay. Stand adjourned. Thank you.
Thank you.
Okay, so we'll shift then to the workshop. Everyone who is here for the purpose of the public hearing, I'm not telling you to get out, but please know you do not need to stay. You're welcome to go. Just give everybody a moment to disembark.
I'll be back.
Okay.
Right, yes.
That entire hearing is preserved, right? In perpetuity
Mhm.
on YouTube. So it's great.
And I think it would be great to direct some people to look at it.
Yes.
The people who need to look at it never
Yes.
will.
Yes.
Never will.
Thank you. All right, so thank you, everybody who was here for the public hearing. We'll go ahead and get started with our August 18th, 2022 Cumberland County Commissioners Workshop meeting. If you would please stand and join me. Allegiance. I pledge allegiance to the flag of the United States and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I call this meeting to order at 10:37 a.m. And at this time, I open up the floor to public comments.
The only one I saw online is Barry, I think it's for.
Okay, so hearing none and seeing none, we'll move on then to agenda item number 3, and I'll call in Tammy Bender. And Tammy, if you would, once you've completed agenda item 3, if you'll just continue agenda item 4.
Okay. Good morning, Commissioners. Finance is requesting approval of 9 budget resolutions. The first one is for community services, increasing revenue and expenses by $20,000. The Human Service Development Funds transferring money to the Homeless Assistance Program for case management. The second one is the Human Service Development Fund. It's increasing revenue and expenses by $2,000. That's because they have a cap on their indirect costs. The next 2 resolutions kind of go together. The first one is for emergency telephone. They're increasing expenses by $210,000. And that's to cover the November interest payment for the 22 general obligation bond. That's for the 25 radio project. And then the corresponding ones on the other side, on the sinking fund, they're increasing revenue and expenses by $210,000. And that's to add budget for the 22 general obligation bond for the P25 project. The fifth one is for the American Rescue Plan. That's increasing revenue and expenses by $15 million. And that's showing up the budget for our estimated actuals in 22. It's going to be the first of probably several resolutions as this program starts to develop. And 6 and 7 go together. The capital improvement funds increasing expenditures by $100,000 to pay the remaining PIV loan back to the Commonwealth to pay for the bridges. And the total being repaid is $1,283,000. And then on the other side, the sinking funds increasing revenue and expenditures by $100,000 to pay back the remaining PIV loan. And then 8 and 9 go together. They always seem like they affect more than one fund. So the last 2 are for the county, the ARP grant program, increasing revenue and expenses by $40 million. That's to establish the budget for the ARP recovery grants for 22. And on the other side of it is general fund increasing by $40 million for the same grant program.
Any questions for Tammy on that one?
And for 8 and 9, we have been given somewhere between 48 and 49 million. Why is the number 49?
That was just our guess of what we were gonna be spending this year.
Okay.
And we may have to change it if we would end up spending more. We could be coming back for another resolution.
That's fine, just wanted to make sure. Thank you.
Just our estimate. Any other questions? Finance is also requesting approval to accept our 2021 cost allocation plan that's prepared by Maximus. It's going to be used in calendar year 2023. The cost allocation plan is used to charge back costs to departments in order to maximize our federal and state funding.
Any questions? All right, thanks, Tammy.
Thank you.
We'll move on then to agenda item number 5, and I'll call on Stephanie Williams to discuss the letter of support regarding designation of local important farmland. Stephanie?
Hi, good morning. So the designation of locally important soils is relevant to our ability to access funds for the Farmland Preservation Program. Typically on an annual basis, the federal government through the Natural Resource Conservation Service will make federal funds available to the county. And this actually comes through the Commonwealth of Pennsylvania. They make application on our behalf, and then the funds go through the state and come back to us on a reimbursement basis. We have been successful in tapping into federal funds in the past, about $2.5 million over the last 20 years or so. But recently we came across a situation where the soil criteria for the program barred us from making applications for certain farms. And just a quick words on soil criteria. Soils are classified by numbers 1 through 8, 1 being the best soils that have, very few limitations for any kind of crop production. Class 8 soils are generally the worst soils. They have severe limitations for growing crops. They might be rocky, slopey, or just have poor soil composition. So what we discovered was that the state minimum criteria was more stringent than the county state soil minimum criteria. So the federal criteria was that 50% of the farm soils must be either prime, statewide, or of local importance. And prime, they consider generally class 1 and 2. Statewide are considered generally class 3. And then we had no locally important soil designation. The statewide soil criteria was 50% class 1 through 4. So essentially the federal requirement was roughly class 1 through 3, and the state requirement was class 1 through 4. So there were farms that were coming in that were eligible for the county state program, but were then not eligible for the federal funding pot. So what we were hoping to do is to be able to level the playing field between the soil criteria in the county state program and the federal state program by requesting that all class 4 soils be designated locally important. So then again, any farm that would come into the county state program, the opportunity would exist for us to apply for federal funding. Now, there's a lot of factors that may go into whether or not somebody would be willing to accept federal funding or if the timing is right for us. But we just wanted to make sure that the door was open for any farms that came into our program, that it was possible for us to consider federal funding should that be an option for that farm. So again, the request would be to support an action that the Ag Board has also taken to request that NRCS designate class 4 soils as soils of local importance so that we can satisfy or have similar minimum criteria for both the county program, county state program and federal program from a soil requirement level.
Any questions for Stephanie?
Stephanie, I have a pretty simple question, I think, and I've been trying to get this answered. Does that change in any way affect our draw on of county funds or change the prioritization process that you have in place for designations of
When
county
you-
recipients?
For selection, no, it in no way changes our ranking criteria. And it does not affect our county or state funds, except to the extent hopefully it will extend our county and state funds as we bring more federal dollars in the door.
Okay, the prioritization is what I was getting at, since
Yeah.
our stated goal is preservation of class 1, 2. So that's helpful. Okay, thank you.
You're welcome.
Any other questions for Stephanie?
No, really, but just a clarification, Stephanie, today, I believe you mentioned, the state county program accepts all class 1 through 4.
Yes.
That has no bearing on the federal program. The federal program recognizes 1 through 3. We're asking the feds to recognize 1 through 4. In that case, a landowner would then have that opportunity to get those extra federal funds if they want to go through the federal program.
Correct. And
It's not a requirement for our plan.
That requirement is already in place, I should say. Our minimum criteria is already 1 through 4. This just evens the playing field, and they still have to go through all the county state requirements.
Thank you.
All right, thank you, Stephanie.
Sure thing.
We'll move on then to agenda item number 6, which is our 2022-2023 Human Services Plan. I'll just mention that this will be on the agenda on Monday for approval. Anything additional to add?
Just that I did give you the signature sheet that's clear so that I can move forward. Thank you.
Okay, all right, so we'll have that on the agenda Monday.
I'm sorry, and I also need to submit the approved minutes whenever that happens.
Yes. Okay, so we'll move on then to agenda item number 7, which is contracts and grants. Section 1 is existing contracts, contract extensions or addenda with no additional cost or increase to the county. Those contracts are for children youth services, criminal justice services, drug and alcohol, and MHIDD. Commissioners, any questions about any of those contracts? Okay, we'll move on then to section 2, which is new contracts, vendor services, grants, and contracts with increases or decreases to the county. And we'll start with Jamie River to discuss the contracts for children and youth. Hi, Jamie.
Hi, good morning. The first contract we have is Central PA Family Support Services. They provide in-home services for us. They are actually not increasing any of their rates this year, but they are adding 3 additional services for supervised visitation and family support programs. The next contract we have is Central County's Youth Center. We started contracting with them last fiscal year due to an emergency need, and we want to keep their option for detention space open. They are increasing their rates from $300 a day to $395 a day, but they're still about $200 below their state maximum approved rate. And their one-on-one supervision is increasing from $18.14 a day to $24.01, and that is only used on an as-needed basis. The next one is for Children's Aid Society. They provide shelter, residential, and foster care services, as well as our independent living classes for youth over age 14. They're asking for rate increases between 1.91% and 5%. Their rates are all at or below their state maximum allowable. They're requesting increases due to an increase to the minimum rate of pay for workers, renovations to the residential and shelter buildings, and an increase in mileage reimbursement and increase of insurance costs. The next contract is for Cornell Abraxas. Cornell Abraxas provides shelter, detention, and residential programs, as well as in-home services. They're increasing their rates between 5% and 62.65%. Their rates were increased to the state maximum allowable for the residential programs, and their in-home programs were increasing 5%. Abraxas cites rapidly increasing costs of care, continued increases to wages and benefits to hire and retain qualified staff, reduction of bed programs and closures, and they continue to use client-centered, evidence-based, trauma-focused care and treatment. To To note on this contract, we've also added to our agreement to reserve 1 detention bed for our juvenile probation office. I think Andy's in the room and I think he already talked to you about this. The cost of the detention bed is $365.23 per day. While the bed is not in use, it will be all county dollars. When a youth is actually placed in the bed, it will be the standard 50-50 split between state and county dollars. And we're doing this due to the ongoing demand for detention beds and the lack of availability that we've seen. Do you have any questions about that particular one? The next one I have is language service associates. This is our interpreter for face-to-face and translation of documents. They are increasing their mileage rate to 11.61%, and they're increasing their minimum fee for a document translation from $150 to $250. We don't typically meet the minimum. We don't go over the minimum fee. However, we don't really have a huge demand for that at this point since we've had most of our documents translated. So it would only be on an as needed basis at this point if we have a family with a language we don't have our documentation in, or there's a change to any regulation. Meraki, Pennsylvania, they provide multiple levels of foster care for children and youth of all ages, as well as family stabilization, which is a program provided to our families while they wait for openings in the family-based program. They're requesting increases to 5 of their 15 foster care programs, and they're adding an additional level of care for infants. Their increases range between 0.65% and 7.53%, with the exception of one that's increasing 24.89%. This is a therapeutic program and it's only a room and board charge. The rest of the program rate is paid by the child's behavioral health insurance. Meraki cites health and wellness benefit cost increases, resources into staff retention for continuity of care for the children. They're in the process of implementing a custom software built to better maintain their foster home regulatory compliances, as well as assist in matching youth for more effectively for available beds. They're investing in the foster parent college curriculum in order to better equip the resource parents to help support the youth in care, and along with additional supports focused on quality have directly led to an increase in their positive outcomes across their foster care service line. The next one is National Mentor Healthcare, doing business as Pennsylvania Mentor. PA Mentor provides foster care services. Their rates are decreasing this year just under 1% for each level, other than their treatment transition level, which is increasing by 4.52%. The decreases are due to the state's budget approval being lower than they had expected. They do cite overall operating costs, the creation of electronic health records, additional trainings for their foster family, and the integration of family visas into practice, which is a trauma-focused, evidence-informed, relationship-based, safety-oriented, child and family-centered therapeutic foster care clinical model. Next, we have the Deborah Foundation. They work with our children with intellectual disabilities. They requested an increase to their IDD program to $450. However, the state approved their rate at $416.47 a day. Thankfully, unlike in the past, they've not agreed to the lower rate that the state approved, but they have this year for us. So their rates are increasing 12.5% to 18.6%. And then there is an increase of 100% for their clothing and personal allowances. However, that's going from $4 a day to $8 a day. And that is only for the youth that are in a placement that's fully funded by the behavioral health. They have cited ongoing training needs, installation of security and monitoring systems, the addition of fencing around the property, upgrades to the fire safety of the buildings, as well as overall operating cost for their increases. The last one I have is the United Methodist Home for Children Board of Child Care Program. They have gone through the process of becoming a specialized setting program through the Families First Act and are providing residential services for youth at high risk or victims of sex trafficking. They're requesting a minimal increase this year of $13.34 a day, or 3%, going from $444.89 to $458.23. They're citing the increase to food and clothing costs for their youth in their programs, as well as the need to increase their staffing due to the specialized setting requirements. Any questions?
Any questions for Jamie? All right, thank you very much, Jamie. As always, very informative. All right, we'll move on then to the district attorney FID, and Eric Radovich should be online to discuss. Eric?
Good morning, commissioners. The contract before you is a as needed contract for a digital forensic specialist named Felicia DiPrinzio, and she will provide occasional as needed tech support and tech review to our computer forensic lab.
Any questions for Eric? All right, thanks, Eric.
Thank you.
Move on. We'll move on then to drug and alcohol, and Ryan Simon is here to discuss the contracts. Ryan?
Good morning, commissioners. Our first one is with Cadenzia. It's for their inpatient services that they provide for us. They're asking for 3 of their rates to be increased. The 3.5 high intensity residential. It's a women with children program at their Vantage location. They're asking for an 11% increase. For their Fountain Springs location, it's also a 3.5 residential women with children program. They're asking for a 6% increase. Finally, their New Destiny location, that's a 3.1. It's a halfway house. They're asking for a 6% increase. Those increases are related to staffing increases. Next is with Hamilton Health Center. They are part of the Perry County Vivitrol Prison Program. Perry County, like Cumberland County, received a grant from PCCD to implement a Vivitrol program in their prison. And that grant is running through the commission, so that's why it's coming for you guys. Their pharmacy, where they get the Vivitrol from, has increased the rate of expense for the Vivitrol from $1,006 to $1,089.77. And then finally, Pyramid, their outpatient contract, like all of our other outpatient contracts, we are looking for increases at those rates. And for Pyramid, we're also looking to add the 0.5 level of care. It's early intervention. It's whenever someone doesn't quite need outpatient treatment, they just sort of, they're getting close to needing some treatment. So our state agency wants us to add that level of care to a number of our providers. So we're adding that on Pyramid. Any questions?
All right, thank you. Thank you, Ryan. We'll move on then to facilities, and Brent Durham is with us to discuss the contracts. Brent?
Good morning, commissioners. First up, the Carlisle Borough reached out to us, and as part of their economic development goals, they're exploring ways to activate what they view as underutilized public spaces that have potential to create vibrant pedestrian-centered spaces. Their belief is that the Veterans Courtyard, because of the location and how well it is maintained, makes for an ideal spot. They're seeking permission to place 4 cafe-style tables along with 16 chairs in the courtyard. The goal is to expand upon the Wednesday farmers market concept. At the same time, provide downtown patrons, employees, residents a place to relax, dine, and enjoy outdoors. The agreement in front of you for your consideration, which was drafted by Assistant Solicitor Jennifer Hipp, permits the borough to place tables and chairs in the courtyard from May 1st through October 15th. The agreement will remain in effect until terminated by either party. It then goes on to outline the responsibilities of each party. The borough will own the furniture. They'll be responsible for keeping it in good repair. They'll provide the county with a certificate of liability insurance. They will store the furniture off season, and they'll also accept our determination of condition and will remove the furniture if we deem it unsafe. On the county side, we will pick the furniture color. We'll choose the furniture location within the courtyard. The placement of the furniture will be, away from the monuments and out of the typical walking paths. Our responsibilities also will be to keep the furniture in their location and to keep it clean. The only cost really to the county will be the amount of labor our staff will have to move the furniture back in place and to keep it clean. We're in the courtyard almost daily during this time of year watering flowers. So, to hose this furniture off to keep it clean will not be a problem. And if we find that the furniture is constantly being shifted around, it will be the borough's responsibility to secure the furniture in place. As facilities department, we're comfortable with these terms and our responsibilities. Any questions on that? Okay, next is TK Elevator. We're asking permission to enter a 3-year contract with TK Elevator Corporation for a service and preventive maintenance contract. The 3-year total cost of the contract is $62,821.08, and this is a CoStar's pricing. The paperwork in front of you, I know, shows a $30,000 decrease from the previous contract, and that's due to the elimination of the nursing home. In actuality, the pricing in this contract has a 4% increase from previous. However, there's a clause in the contract that has a 4% discount if paid annually. Our intention is to take advantage of that discount so that our total cost over the next 3 years will be equal to what we paid in 2019 through 2022. The service includes examination, lubrication, repair and replacement of parts. It also includes elevator entrapment response and required annual and 5-year safety testing. Any questions on that?
No, thank you very much, Brent.
Thank you.
All right, we move on to human resources, and Tabitha Coons is online to discuss the contract. Tabitha?
Good morning. Before you is an application agreement with Partnership for Better Health. It's an agreement to enter their program as a Tier 3 member, which is the option to participate in their initiative at no cost to the county. This does not include them providing us with any grant money either, because we are entering as a Tier 3 for the nonprofit company. Basically, the only thing we have to do is attend at least 3 of their partnership meetings and implement 1 new promotional wellness program for the year. We've been doing this and been a member with Partnership for Better Health for several years now. So this is just their annual application renewal that we need to complete every year to continue to participate in their program at no cost.
Any questions for Tabitha? Okay. So Sue, thanks, Tabitha. So Sue is here in person, and she's going to take a deep breath because she has a very long list of contracts to discuss with you.
Okay. Okay, so let's start with early intervention. The first 2 are amendments for 21-22. So early birth therapy amendment is an increase of $26,136 for fiscal year 21-22 based on additional authorized services. United Cerebral Palsy Central PA is an amendment for fiscal year 21-22 of $10,000, $10,502 for additional authorized services. The next contract, the Advocacy Alliance, is a intellectual disability amendment for fiscal year 21-22. It's an increase of $6,156 for additional services, and those services are like the nursing unit and certified investigations. Next contract, their intellectual and developmental disability 22-23 contracts. Benevolent Heart Assisted Living is a renewal. The contract amount will be $58,476. It is a decrease because they had a respite in their contract for last year. Goodwill Keystone area is a renewal. It's a decrease of $4,970. The contract amount will be $66,300. It is for supported employment and project search. The Arc of Cumberland Perry Counties is a renewal for this year. It is also a decrease of $149,885. The contract will be $452,449. And United Cerebral Palsy of Central PA is a renewal for $505,887. Next contract is a mental health amendment for 21-22, which is NAMI of Cumberland and Perry counties. It's an increase of $5,982 for family support. The next three contracts, I think they're the last ones, are mental health contracts for fiscal year 22-23. Cumberland County Prison is a renewal. The contract will be $37,100. The next contract, New Visions for Community and Housing Support, is a renewal. It's an increase of $304,673. The whole contract will be $3,019,463. It's just for the increase to residential housing support. And the last contract is for New Visions, the LTSR. It is an increase of $63,769 for a total contract of $1,703,679.
Any questions for Sophie? Okay, thank you.
All right, thank you.
All right, next we have Claudia Garner joining us online to discuss the continuation for public safety.
Yes. Do you want me to talk about the other items on the agenda too, or just wait?
That would be great. Yes, thank you.
Okay. All right, good. All right, so public safety is asking for your approval to extend the computer aided dispatch, known as CAD, maintenance contract through our current vendor, Intergraph Corporation, also known as Hexagon, in the amount of $266,302.56. This is, you'll notice, a approximately $20,000 increase from year to year. And at first glance, that's a 40% plus increase. However, there's a reason for that. There were several interfaces and various systems that were not brought online until about 5 months into the contract. So you remember the change orders that you've been approving. And so we only paid for 7 months of maintenance for those specific services. This renewal will include the full 12 months of those services now that everything is online. It also removes 4 of the line items that were in change order 6. And if we would have those interfaces in service the past year and compare the annual cost to the current renewal, it would reflect just like a 2.5% increase. So it's pretty much right in line with inflation. The CAD system vendor is specific for the maintenance, so it's sole source, and our CAD team, tech team, has been pleased with the customer service, and our staff has adjusted well to the new product, and it's working as designed. And we would like to continue this maintenance contract. Then it would be 1 calendar year starting September 1st and ending August 31st of 23. Any questions on the contract? Okay. Item number 10 on your agenda is for 2 capital project requests. We are asking for your approval for a capital project to make the necessary modifications to our 2005 hazmat emergency response vehicle, known as Hazmat 202. We're asking for a not to exceed amount of $28,000. The project has 3 elements of upgrades. 1 is the emergency warning light system, 2, secure mounting of the equipment, and 3, the roof ladder access install, all of which are for the benefit of personnel life safety and equipment sustainability. The warning light package is roughly $14,000. This is a 17-year-old vehicle, and the exterior warning lights need to be replaced and upgraded for better visibility of the passing motorists and to reduce the unnecessary risk for emergency personnel safety. The second part of it, the secure mounting of the equipment. With the purchase of the hazmat vehicle last year and a half, we were able to redistribute the equipment amongst the two units so that they can properly and efficiently respond to both in and out of county emergencies. And we have to meet the NFPA standard 1901, which requires loose equipment in the cab area to be properly secured. That element of the project is roughly $4,000. And the last part, the roof ladder, that is to replace the existing ladder, which is a very vertical ladder on the back of the unit, with a Zyco ladder, which has more of an incline, making it safer to ascend and descend and get the equipment from the rooftop of the apparatus. And that is approximately $3,500. The vehicle itself has just under 9,000 miles on it. It averages 30 to 40 responses a year, and it functions as the secondary emergency response unit for hazmat calls in the county and is the primary response vehicle for out of county. So this not to exceed capital project of $28,000 to make these necessary modifications will extend the useful life into 2031 when it's planned for replacement. That's, of course, in our crystal ball of no other mechanical needs that we would need. So that is that capital project. Any questions on that one? Okay, and the second one on our list is a not to exceed capital project request of $65,480 for a purchase of a new pickup truck for our fleet. As part of our long-term vehicle plan, we need to replace the 2006 Chevy Impala that is in our fleet. We purchased that in 2010 from the sheriff's office. It is 16 years old, four-door sedan with 139,000 miles on it. In the 12 years that we've owned it, we average about 7,000 to 8,000 miles per year, and of course extended its useful life for general office travels. Facilities management, Brent, has evaluated the vehicle and has deemed that there is not a need in the county fleet for it and recommended to place it on municipal once we get the replacement vehicle. He said they've been getting some pretty good return on placing them out on municipal. So that would help to offset our cost. Having a pickup truck versus a passenger car will allow us to transport up to 6 staff and or team members, hauling loose equipment in a covered and secured truck bed, and then also be able to pull all of our emergency response trailers. It does meet all the recommendations and specifications to have for a reliable emergency response tow vehicle. And then it will also need to have a warning light package installed that meets the NFPA standards that I talked about with the hazmat truck, and then the lockable bed cover. So all of that plus the 5 years of annual maintenance of oil changes and inspections, we're estimating $65,480.
Any questions for Claudia? All right, thank you, Claudia.
Thank you.
We'll go back to contracts and grants. I'll call on Justin Miller to cover recycling and waste. Hi, Justin.
Hello. So I see you saved the best for last, or at least that's what I'll do. Okay, before you are waste disposal capacity agreements for our waste management plan. These agreements solidify in writing the number of tons per year a disposal facility will guarantee for Cumberland County waste for the next 10 years in return for being named in our plan. I'll just quickly go over the facilities and the tons per year that they're guaranteeing us. And I apologize, they're not in the same order as what's on your agenda. I'm reading these right out of our plan. Cumberland County landfill, 50,000 tons per year. Mountain View Reclamation landfill, 47,772 tons per year. Those two facilities are owned by Waste Management. Modern landfill, 130,000 tons per year. Conestoga landfill, 130,000 tons per year. Those two facilities are owned by Republic Services. Sandy Run landfill, 25,000 tons per year. Southern Alleghenies landfill, 10,000 tons per year. Those two facilities are owned by Noble Environmental. Blue Ridge landfill, 13,000, 50 tons per year. That facility is owned by Waste Connections. Commonwealth Landfill, 500 tons per year, and Keystone Landfill, 500 tons per year. Those two facilities are owned by Louis de Naples. Susquehanna Resource Management Complex, 10,000 tons per year. And the Lancaster County Solid Waste Management Authority Resource Recovery Facility, 5,000 tons per year. Those two facilities are owned by Lancaster County and they are incinerators. So when you add all those numbers up, it's an annual guarantee of 421,822 tons per year. And when we did our analysis of what we need per year, the maximum amount, which would be in year 2032, was 293,577 tons per year. So this shows to DEP that we have secured sufficient capacity for our waste for the next 10 years. Any questions?
Any questions for Justin?
No.
Thanks very much.
Thank you.
Okay, that takes us then to agenda item number 8. And I'll call on Stephanie Williams. And I'm sorry, Stephanie, I should have noticed and asked you to cover this earlier. You've probably been hanging around online, but I'd like you to discuss the bid results and recommendation for the rock solid dairy circular storage tank project.
She's actually not on. There was a confusion between that bid result, the next one, and that one, and she thought that you were covering both.
Okay, I will cover both of those to the best of my ability. So as you know, we have shifted over to PennBid for several of our projects, and the first bid is goodness sakes here. So there were several bids that came in. The recommendation to award is to Stoltzfus Pro Concrete. If you have any questions about the bid itself or the recommendation, Kirk Stoner will be returning on Monday. And certainly before the meeting, I can get any details for you. But it's a pretty straightforward bid recommendation. Agenda item number 9, you'll note that this is noted as action requested. There was a missed email. This is not action requested today. So this is just discussion of an approval of the notice of award and also award of the 2022 bridge debris removal contract. That also was advertised in PennBid. Commissioners, if you recall, at the June 23rd workshop, there was an approval to put this out to bid. There was a lot of information shared at that time regarding debris removal and what our needs are, that these projects are done on an as-needed basis. So again, this was bid, and the recommendation is to award this to JDI Site Solutions LLC for an amount of $89,981.70. An additional request is to authorize the planning director to execute the project contracts, of course, after review and approval by our solicitor as well as HRG. Do you have any questions about the bridge debris removal? Okay, so that will be on the agenda on Monday for approval. We've already covered agenda item number 10, and so I'll move to agenda item number 11, which is Commissioner's Liaison Reports, and I'll start by calling on Commissioner Eichenberger.
In the interest of time, I think I'll just skip.
Okay, so I'm sure we'll have lots of great updates on September 1. Commissioner Fauci.
So I will quickly, Library Board, we met on Monday. Pleased to report that the governor signed the state budget on July 8th, which increased the public library subsidy to $70,470,000, which is a historic $11 million increase. That is good news for our public libraries in Pennsylvania. I would remind you to use the library. They're wound up their summer reading programs. They wound up Go Cumberland. It was very successful. And this morning I had planning, and again, I had to leave planning before it was over, but I will let you know that the Dickinson Township 2022 comprehensive plan was recommended for approval. The Dickinson and Penn Township Newswanger Ag Security Area was recommended for approval. everything that is produced that goes to a planning meeting now is available online prior to the meeting on the website. And the commission is spending a significant amount of time talking about how they can make these meetings more productive and better for the public. And that's it.
Thank you. And Commissioner DeFilippo.
My assigned groups met during the last 2 weeks, due mainly because most of them didn't meet in August, but I will have updates at the next workshop for the Conservation District and Housing and Redevelopment Authority.
Okay, thank you, Commissioner. I would like to report that an executive session was held on August 17, 2022 at 9:30 a.m. regarding personnel. And is there any other business to come before the board today? Okay, hearing none, seeing none, we're adjourned.